We all may sometime along the way face mental, behavioral, and emotional troubles which may get to a point of requiring some form of assistance in order to resume functional capacity and carry on with day to day activities. Most of us may find certain coping mechanisms to deal with daily stresses or troubles of life. However, some may find coping mechanisms unsuccessful, thence requiring therapy. This is where the role of a psychiatrist comes into play. Here we will be learning the functions of the department, the team players in this department, how time can be managed well while training in this department, the roles and responsibilities of a house officer in the Department of Psychiatry, the expectations of being a house officer here, and last but not least, the pathway to specialization in this field for those of you who might be interested to understand the journey or maybe live one. Let's get started. The term psychiatry comes from the medieval Latin term psychiatria, which means healing of the soul. The root word is psyche, which refers to mind, and iatria, which means healing or care. Psychiatry is the branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. A psychiatrist is a medical doctor who specializes in mental health, including substance use disorders. They are qualified to assess both the mental and the physical aspects of psychological problems. People seek psychiatric help for many reasons. The problems can be sudden, such as panic attack, frightening hallucinations, thoughts of suicide, or hearing voices. Or they may be more long term, such as feelings of sadness, hopelessness, or anxiousness that never seem to lift, or problems functioning, causing everyday life to feel distorted or out of control. There are numerous staff and service providers working together in the Department of Psychiatry to ensure the objectives of the department are met. Let's begin with the doctors. The department head usually holds a post of a consultant. The head of department runs the department, essentially looking into the financial needs, resource needs, and overseeing the day to day activity of the department. The HOD represents the department to important meetings, raise issues to the attention of the hospital director, and manage the department's budget to ensure adequate medications and equipment are available. As for the consultants, they are seen in the wards and clinics at least on a weekly basis. The consultant oversees the patient's diagnosis, investigations, and treatment plans. He or she also troubleshoots difficult problems as well. The specialist leads a team of doctors during the rounds, and in the psychiatry department, the bulk of the work lies in the clinic where the consultation sessions take place. Because they are physicians, psychiatrists can order or perform a full range of medical lab and psychological tests, which combined with discussions with patients help provide a picture of a patient's physical and mental state. Their education and clinical training equip them to understand the complex relationship between emotional and other medical illnesses and the relationships with genetics and family history to evaluate medical and psychological data to make a diagnosis and to work with patients to develop treatment plans. Also take note, the psychiatrists here will be your assessors at the end of your posting. They will also supervise teaching and CME sessions. The medical officer in the ward is your one-up who reviews the patient with you before the psychiatrist arrives. It is advisable that the house officer brings forth any setbacks pertaining patient care or management that he or she may face to the medical officer in the ward. Next come the nursing staff. The nursing staff in each department is led by the matron of the department. So matrons are in charge of nursing service divisions and are directly accountable for the proper organization, direction, coordination, and direction of the nursing services. They are nursing representatives of their wards to raise issues to the hospital director. They are dressed in dark blue colored nursing uniform. Then we have the sisters. The ward sister organizes all nursing activities of a unit in accordance with hospital policy and rules. The ward sister also directly supervises patient care of the unit and provides direct care to seriously ill patients as and when a situation arises. She manages and arranges the rosters of the nursing staff team and also helps the nurses carry out their duties in the wards if they become too busy or overwhelming. And lastly, we have the nurses who provide direct patient care. They're responsible for obtaining patients' vital parameters and charting them on the medical observation charts. They will take over the charge from the duty nurse of the previous shift regarding patients, instrument supplies, drugs, and hand over the same to the next shift. Every day, one of the nurses in the ward will be assigned the medication administration role and will be stationed by the medication trolley to prepare and dispense medications to patients. Next, we have the allied health professionals. For example, here the pharmacist. The ward pharmacist follow the ward rounds led by the specialist or the consultant and provide their consultation on the safety of therapeutics prescribed, alternative drug therapy, double checking on dosages, and orders to prevent medication errors. They also provide suggestions to manage the current medication supply available in the hospital. Let's look at the roles of a clinical psychologist. A clinical psychologist works hand in hand with a psychiatrist. They provide non pharmacological therapy to patients who require counseling and psychotherapy. They meet with patients to identify problems, emotional, mental, and behavioral issues in their lives. Through observational interviews and tests, the psychologist will diagnose any existing or potential disorders, and then, together with the patient and the psychiatrist, they formulate a program of treatment according to the patient's needs. And the psychologist will also monitor the patient's progress on a regular basis to ensure that their needs are met by the course of action and to adjust it if necessary. Next is the clinical assistants. They're involved in a range of duties associated with the upkeep of the ward environment, cleaning medical devices, and to maintain the highest standards of cleanliness throughout. They are also responsible for giving out meals and drinks to patients and ensuring menu choices are complete. They also take care of patient restraining, lifting, and transportation. Now let's quickly run through a flow of patient admission to the psychiatric department to get some clarity. Patients are admitted to the ward either from the clinics or through the emergency room or from other wards known as peripheral admissions. First, through the clinic visits, here new cases which are referred from other centers or follow up of existing patients make the bulk of the cases. In the clinic, you'll be tasked to clock new cases, do a follow up review on existing patients' progress, and perform necessary tests of procedures if needed. If admission is indicated, the patient is then admitted to the ward. Similarly, as a patient comes from the emergency room, triaging is done where the type and severity of the condition is assessed and determined. Based on the triage level, patients will be moved into the appropriate zones. Any disorders involving behavioral or emotional troubles are referred to the psychiatry department. Next would be once the patient gets admitted to the wards. The house officers have the first few contact encounters with the patient. Here, you are expected to review the progress of the patient from time of presentation to the ED, identify any new issues, request any necessary imaging studies, and carry out procedures if necessary, as well as place medication orders and execute the pre-operative plans given by the operators. Now, let's take a look at a few tips on how you can manage your time. Time management is extremely crucial to reap the maximum benefit of training during housemanship. Let's take a look at a few tips. Tip number 1, create a job list. Make a customized table to summarize your ward works or tasks systematically. Prioritize ward work that needs to be done within office hours. Cross out the tasks that had been carried out to avoid confusion between colleagues. Delegate tasks among you and your colleagues, such as blood taking, referrals, requesting imaging, assisting in procedures, and many more. Next would be to familiarize with your patients and their surroundings. Allocate at least 15 to 20 minutes to review your patients daily before the rounds begin. Remember the important things about your patients and their significant results. Check the necessary parameters and attachments on your patient, and save the necessary emergency contact information for the day, such as the psychiatrist or the medical officer in charge or on call, as here in Malaysia, we do not use a pager system. Next would be take turns with your colleagues if you wish to take a break, and notify your team members or senior colleagues on your whereabouts to ensure miscommunication is avoided. Be early to reconfirm your patients' cases which have been scheduled for daycare services such as electroconvulsive therapy. And finally, use electronic and digital productivity tools which most of you might already have in your daily usage devices such as your smartphone, iPads, or a digital notepad. Utilizing the reminder, notifications, and planner apps or systems can not only save your time but also ensures tasks are complete. So, what do you expect as a house officer here? Here in the psychiatry department, we have learned that interview and listening skills are given much emphasis as the diagnosis is based on the content and the manner of which the history is provided by the patient as well as the observation made. Here, you should train yourself well in understanding nonverbal cues of patients and work on your interpersonal skills to enable a purposeful communication with fellow staff and patients. You're also expected to have a non judgmental attitude and perspective towards patients or mental health conditions to ensure stigmatization of conditions are eliminated from practice. Now, as you progress through this specialty, you find yourself having an interest in this field and plan to specialize in it. So, how do you go about it? The Psychiatry Postgraduate Training Program is a comprehensive program that aims to ensure that trainees acquire the knowledge, skills, and attitude that are necessary for the practice of psychiatry. At present, there are two pathways available for postgraduate training in psychiatry within the national curriculum. First is the Ministry of Higher Education pathway, and the second, which will be discussed later, is the Ministry of Health pathway. So, the Ministry of Higher Education Masters in Psychiatry is a 4-year program in which trainees are registered to specific universities and undergo general and subspecialty postings in the university and the Ministry of Health accredited hospitals. Upon completion of housemanship training, one can then pursue with the Medical Specialist Entrance Exam or MEDEX and obtain satisfactory results for the entrance interview. Applicants who are currently employed by the Ministry of Health and require a scholarship should visit the website of Sistem Permohonan Hadiah Latihan Persekutuan. Applications are submitted online to the Medical Development Division of the Ministry of Health, and they are evaluated based on the entry requirements. The shortlisted names will be forwarded to all universities in Malaysia that run the program. Applicants who are not from the Ministry of Health, private or international candidates are required to apply via the graduate website of the university of their choice. Next is the Ministry of Health pathway. The trainees choosing this pathway undertake the same learning opportunities and workplace assessments as in the Ministry of Higher Education pathway. They also take on general and subspecialty postings in the university and Ministry of Health accredited hospitals. The area in which the pathway differ is the summative assessments, which in the case of Ministry of Health pathway follow the framework of a professional organization such as the Royal College of Psychiatrists. This framework allows the trainee to choose the time at which they enter the exam within the overall constraints imposed by the recognized external colleges. To enroll in the Ministry of Health pathway, applicants must ensure that they are able to meet the membership requirements of the respective recognized external colleges such as the Royal College of Psychiatrists. To fulfill these requirements, they should register to take the relevant exams, clear their Part A or Part B, depending on their eligibility. To register for the Ministry of Health intake interview, on passing the examination, applicants are required to send a copy of their results with the registration form for medical officers during the MOH pathway via their respective hospitals to the Medical Development Division of the Ministry of Health. The applicants will then be called for an interview on a date fixed by the Ministry of Health. Applicants who pass the interview and meet all the requirements successfully will be informed by the Medical Development Division, Ministry of Health, of the date of commencement of training at the accredited healthcare facilities. It is a 3-phase program over a minimum period of 4 years, regardless of the pathway chosen. The training is conducted at university hospitals and at any of the accredited government healthcare facilities. The phases of the program, as outlined, are designed to promote clinical skills in psychiatry, professionalism, and independence among trainees in their preparation to become a psychiatrist. Assessment of the trainees' progress in the training program are carried out throughout the duration of the program, and in particular to assess the trainee is ready to move on from one phase to the next phase. This is the list of recognized postgraduate qualifications in Malaysia for psychiatry. These are the local and overseas programs that are recognized postgraduate qualifications to practice as a registered psychiatrist in Malaysia. You may find this list on the Malaysian National Specialist Registry website. And finally, let's take a look at subspecialties in psychiatry. We have the child and adolescent psychiatry, geriatric psychiatry, forensic psychiatry, addiction psychiatry, pain medicine, psychosomatic medicine, and sleep medicine. So some psychiatrists choose additional training in psychoanalysis or in psychiatric research as well. In summary, we have looked at what does this department essentially deal with, who are the essential team players that make this department work, simple tips on how time can be managed well while training in this department, understanding roles and responsibilities of a house officer in the Department of Psychiatry, what is expected out of you while you're on duty as a house officer here, and the pathway to specialize in this field upon completion of housemanship training for those of you who are keen to join this field of medicine. There are plenty of online resources available to assist with your learning process while you are in training as a house officer in the psychiatry department. You are encouraged to be resourceful as it makes your job easier. Here we will be going through some useful resources to aid your quest for department-related information and skills training. This is a professional medical body responsible for supporting psychiatrists throughout their careers from training through retirement and in setting and raising standards of psychiatry in the United Kingdom. The Royal College of Psychiatrists is the professional and education body for psychiatrists in the UK, and the purpose of this channel is to share video resources with other professionals and interested members of the public. You may find the videos on psychiatry by RCP Psych. Next, we have the Psychiatry and the Mental Health Services Operational Policy. This policy document covers key areas of psychiatric services such as organization, human resource, and asset requirements, as well as patient management, ethics, and clinical governance. It is intended to guide mental health care providers, hospital managers, and policymakers on the requirement, operation, and development of psychiatric services in the hospitals and health clinics in Ministry of Health Malaysia. The document outlines the optimal achievable standards in accordance with best practices and guidelines. In hospitals and health clinics where these standards are not fully met, necessary steps need to be taken to meet these standards. Then we have MedCircle, which is an intelligent mental health information delivery service which continuously monitors and curates the best and latest mental health information from hundreds of credentialed resources. And finally, we have a YouTube channel called Choose Psychiatry, which is created by the Royal College of Psychiatrists, which creates and shares plenty video resources with other professionals to assist with recognizing, diagnosing, and also managing psychiatric conditions. The videos here aims to reduce and end the stigma against psychiatric conditions by providing awareness on the conditions and how they can be controlled and managed so that the patients are able to have a life with quality. Well, we have finally come to the end of this session. We hope this session was insightful and thank you for your time.